that on my own mama, on my hood. I look fly, I look good. You can't touch my bag, but you could. I look fly.
Hey everyone, as you guys can tell by the title, this is gonna be like a week of my life here at Clinicals. This is my first rotation and I've been here for about 6 weeks. I'm actually closing out this rotation. I have about 2 weeks left here. So yeah, I just wanted to kind of bring you guys along. So yeah, I'm just gonna take you along as best as I can and just talk to you guys and show you what I do. This rotation is floor assessment, and y'all excuse my voice, I'm really not feeling the best. But one thing about my program and most accelerated programs, you really cannot miss clinical days. If you do miss a day, you will have to make it up. So for my assignment today, I have 2 floors. So I have east and then the north floor. I have a total of 7 patients, and then we have 9 different medications slash breathing treatments that I'm administering. So most patients that I have are just getting the duoneb. This is duoneb. So it's albuterol mixed with pulmicort or budesonide. Then I have a few just single budesonides. I have a performamist. That's not performamist. Performamist. And then I have another budesonide, but a different dose. So I actually need to go get that. It's currently, what time is it? It's currently almost 7. And here at this location, at this rotation, you can either do it an hour before or an hour early, or you know, right at the time. So I'm gonna go ahead and go up there at 7. I currently do not have a wow today, and a wow is like this big machine that we usually carry around. I'll show you guys it just in case you guys will have it at your rotation. Yeah, I'm gonna show you how I'm getting vitals and all that though, so come on. Okay, this is what I use to take vitals. So I actually came in here to find a mask, but I just wanted to show you guys the point of use room, and I think this is just hilarious. I have 2 more breathing treatments to administer. Okay, so I'm finally done. I actually had 3 patients, not 2, but my last one refused. And what I mean by refused, it doesn't always mean they're like, no, you get the hell out of my room, you know. She just got back from surgery, so she was just like, can we just skip it? And I was just like, yes, ma'am. So yeah, gonna head back down to the little room and finish charting. These are the medications that I have left. I don't really know why I have this. I don't know why I took 2 of these, because I didn't use this one at all. I'm just gonna put this over here. And then, like I said, I have 2 floors. I have north and then the east floor. So I'm gonna check just to make sure nothing popped up for the east floor and everything was good, because I have 2 PRN patients. And if anybody is, you know, admitted to that floor, I just have to keep checking to make sure, you know, everything is good. Okay, so yeah, now that that's done, I know you guys really didn't get to see me doing anything for real, except I just try to show you guys some medications. That's obviously because of this thing called HIPAA, and just to, you know, protect my patient's privacy and all of that. So basically what I do, like I said, I am a student. I'm not like a real RT, respiratory therapist student. But at this rotation, I'm able to go by myself to give treatments. Basically what I do is I knock on the door, and then, you know, I introduce myself. I'm like, hi, I am so-and-so with respiratory. I'm here to give you a breathing treatment. And then for the most part, people are like, okay, or right there, they'll be like, no, I'm good type thing. So because I don't have a wow is like the cart that I showed you guys. I used to, but because it's a lot of RTs here, I just don't have one. So because I don't have that, I use the computer that's in the room. You know, I log in, and because they use a pretty old system, it takes a little minute to, you know, start and everything. So what I do is I go ahead and start taking the patient's vitals. And so this is what we use to do so. I just turn it on, and I wipe it down before and after every use. So, you know, I turn it on, put it on the finger, and then it'll tell me like the SpO2 and the heart rate. And those are like the main vitals that we need. And then of course like the respiration rate. But for the most part, the patient's respiration rate for the most part is going to be between 16 and 20. 16 and 20, especially like on the floors. Now in the ICU or ER, it might be something a little different. But for the most part on the floors, everyone is pretty stable. So it's not gonna switch up too much. So yeah, after I get the patient's vitals, then by that time my computer is kind of up and ready to go. So I scan the patient, scan the medication, and then I go ahead and, you know, put it in a little nebulizer, give it to them, turn the flow up. I do 8. I know some people, they do 9 or 7, but I do 8. I feel like it really, you know, gets done in 5 minutes. I want to do breathing treatments for 5 to 10 minutes, just depending on how many medications are in there. For the most part, I think I only had 2 patients that had 2 medications in the treatment. And so for that, it would be like 10 minutes. Most treatments, they are Q4, and that means every 4 hours. For most of my patients, they're either Q3 every 3 hours or Q4, and then I have a few BID patients. Day shift, for the most part, it's about 3 to 4 rounds that you're doing. So your morning rounds, that can vary from 7 to 8:30. Those are like the scheduled times. And then you have your midday, your mid-morning rounds. Usually that's at 11 or 12. And then you have your 2:30 or 3 p.m. rounds. So 700, 1100, 1500, or 1430. That's like the military terms. I'm still learning military time. Personally, me, I just feel like it's extra. Like we can just do regular time, but you know, I don't know. That's just the healthcare world. So anyway, for my 11 a.m. rounds, I only have 2 patients. So that's nice. And they're both, oh no, one is albuterol, and then one is getting Duaneb. So yeah, these will be, as a respiratory therapist, that's the routine stuff. But it's definitely way more than just giving breathing treatments. So far, I've assisted in an intubation and an extubation. I've bagged a person while they were unconscious. I've done assessments and treatments in the ER. It can be very complex. It really just depends on the facility, the day, the time, the area, you know what I mean? So yeah, I definitely love it so far. And yeah, I just can't wait to continue to learn more and to see more. Right now, because I'm not doing anything and I'm not just gonna sit in here, I'm gonna go to the other room. I'm in this room by myself because the other room is just packed, and you know, I don't really mind kind of being alone, or I really don't. So I'm in here just to have more room, most importantly. But I am gonna go in there, you know, chit chat with them and try to see some cool stuff, because this morning while we were taking report, this lady, one of the RTs, mentioned to the lady that was, you know, doing the ICU, like, if you have to intubate, like, just tell us. And I'm like, intubate? So yeah, if they intubate, I definitely want to be in there. Y'all, I just witnessed the most chaotic intubation I've ever seen. Now granted, I've only seen one, but I know how it's supposed to look, and I know how it's not supposed to look. This intubation, I'm not assisting at all. I'm just watching because there's 2 RTs. So we're in there. From what I can see, the sats are decent. his stats were decent. His respiration rate, I can't remember exactly. I know he was an AFib, but it wasn't extreme like how it ended up. But I feel like it was 10 something. And then his respiration rate was 22. His SpO2, I want to say, was probably like low 90s, but he was stable. He was stable. So yeah, when we go in there, it kind of is like we're missing, like, so as far as RT, so it does vary from hospital to hospital, state to state, things like that. But at this hospital, RTs, we assist doctors, so the doctors really just do the intubation. They get the little Pat McGrath, they put it in there, and then they stick the tube down. We like remove the tube, we inflate the cuff, we listen to the breath sounds to make sure they're bilateral, we put the end-tidal on, we bag, we do a lot. So before we get, or when we're about to start, the doctor, he's kind of just like ready to go. I don't know if he was like on a tight schedule or whatnot, but he was kind of very much like, let's go, even though like it was still things that like wasn't necessarily done. For some reason the doctor was rushing. I'm not gonna put it all on him, but it was kind of like, you know, he's like asking about certain things and we're saying like, no, we don't have it, but he's still kind of like, okay, let's go. And it's like, okay. So like, honestly, the nurses, they were kind of ignoring him, not ignoring him in a rude way, but it's like, you're asking, like, he was trying to put the bed down already, and it's like, dude, like, we haven't even like sedate. I'm talking about the nurse's side, like they weren't even like done sedating, they were still setting things up. So it's like, it was very strange. I don't know why that doctor was doing that. But anyway, yeah, that's what happened. And so at that point, they're like about to start. There's no ambu bag in the room. Thankfully, I was about to say something because I didn't see the ambu bag, but then the one RT, she was just like, hey, go get the, or can we go get the ambu, something like that. And so they got the ambu bag, and the ambu bag is this, and that's what we put on the tube to, you know, oxygenate before we hook up the vent. And so yeah, they get the ambu bag, still like a little rushed, and so now they have the end-tidal. Now the RT that has only been in the field for a couple of months hands the end-tidal to the RT that's been in the field for 10+ years, right? She gets handed the end-tidal. Now, an end-tidal looks like this, and the purpose of an end-tidal is to put it on after the tube to make sure the tube is in the patient's lungs. Very important, right? So tube goes down patient's throat, they're bagging. No, I'm sorry, before that, right? So the patient gets taken off the vent immediately, or not immediately, I mean, I say immediately, but within about 2 minutes the sats are dropping. And again, normal ranges for your sat, we want it to be above 88. Y'all, the sats went down to like 70 at first. So anyway, sats are dropping. Anyways, doctor intubates. Okay, cool. Attaches the RT, the one that's been in the field, attaches the ambu bag. And I feel like this is kind of where it kind of went left a little bit. RT that's been in the field, she's bagging. The doctor asked for the end-tidal. We can't find the end-tidal, or not me, because I'm just a bystander. I'm a bystander. I'm a student looking for the end-tidal. You know, at that point, y'all, the sats are hitting the 60s. The sats are in the 60s, and I'm looking like, what the hell? Respirations is in the 40s, y'all. The patient is not unconscious. The patient is up. Now, I've heard that some intubations, the patients are not completely sedated. Now, the one I seen, the lady was out. She was cold blood out. She was knocked, you know. But they said it sometimes is normal. So I'm like, okay, y'all. Again, the sats now, they're dropping in the 60s. I seen it hit 50. I'm not even kidding, y'all. That's scary. Now, the doctor, before it hit the 50s, it was probably like in the 60s, but the doctor's concern was like, he's not cyanotic, so you know, it's kind of all right now. So he left. The doctor left. But anyway, so he is hooked up to the vent, and they're trying to like mess with that so his sats can go up. But at this point, like, he is awake. He's completely awake. His eyes are like completely open. Like, he's trying to He did have restraints on, so his hands were like this, but like he's kind of starting to kind of get up. Like he's kind of twitching his legs, like y'all, like it's bad. For me, that was the most chaotic intubation I've seen. So yeah, like I said, I think that was really chaotic. The patient very well could have coded. That was a lot. I've never seen anything like that. But yeah, it's 10:19, so I'll probably be doing my 11s pretty soon. I only have 2 treatments to give. Need to check East to make sure no PRNs came up, and they have not, so hopefully nothing else crazy happens today. So at this hospital, the little, like the mouthpiece or the mask that we're using to give the breathing treatment goes in this. So one of the patients that I seen, they didn't have a bag, which is really weird. I'm just gonna fill this up. And this one. Okay. So yeah, let's go to the ICU and see what's happening there. So I had 2 treatments to do, but I only did one because the second person was sleeping. Me, I'm not really the type to wake up a patient if they're sleeping. I'll just come back, especially if they weren't, you know, like asthmatic or wheezing hard. I could just come back. So yeah, I'm about to go chart that the patient was sleeping. Next rounds are at 2:30/3. I have some scheduled for 2:30 and then some scheduled at 3. I'll probably go at 3. And it's 10:51 right now, so yeah. I'm gonna go back to the ICU just to see like if there's anything happening. And I'll probably just sit in the room with them for the most part. Oh, let me check my other floor. I don't see anything, so I think we're good. Yeah, we're good. It's like 12:40 and it's definitely been a busy day. After my treatments, I went to the room, and since then, like I've just kind of been following an RT because they have the ICU today. It's been a lot of vent checks. We had a new patient that came intubated on a vent. The last guy that we seen, we did a vent check on him, and also like he was doing dialysis. So I feel like I'm just seeing a lot. I need to drink my water. So it is currently 1:09 p.m. I'm gonna go ahead and take my lunch before it's 2 because I have to heat up some stuff, and the cafeteria here closes at 2. But before I do that, I'm gonna go to the ICU, ask if they need help with anything, and if they don't, so like I said, I'm gonna go ahead and go. It's 2:03 and I'm about to head upstairs. I'm just gonna get my medication. So there's not a lot of doing up in here, so I might have to go to the main room. Yeah. Let me check these other wows first. I'm gonna check these 2 before I go back. There's nothing in there. I'm gonna have to go to the room to get my medications. So I need Performamist, Atrovent, and 5 Duonebs. After 2:30 rounds, I had about 6 treatments, and someone from my school came to speak with me. They do that every other week. But yeah, after that, I've kind of just been over it. It's been a long day. So I thought I was about to leave because I needed to go to my school to get something. But before I went up to the floors with one of the other RTs because we had to do a blood gas. I'm like, okay, cool. You know, I just wanted to watch. And we're doing the blood gas and, you know, she can't get it, the RT. And so she's like, hey, can you go downstairs and get me another kit? I go downstairs. By the time I get back up, it's like the nurse leader and a whole bunch of other people down there. About a minute or two, I hear them like, she's going down, meaning we're transferring to the ICU. So it's like, okay, she's on a vent, she was on a BiPAP right now. And so, you know, we start transferring her. The ABG was gotten. But anyway, so we're on the way downstairs. So, you know, we're downstairs and she was about to get intubated. So, you know, they're intubating her. Y'all, it's probably about like 5 people in the room at this point. It's 3 doctors, 2 resident physicians, and then 1 actual attending. 3 nurses, 2 RTs, and then me. And then maybe a couple other straggle nurses. So her sats just keep dropping, y'all. Like 60. And then I keep hearing them say like, it's hard to back her. Her sats just keep dropping. They drop all the way to 40. I see the monitor say asystole. I'm like, I look up and I'm like, I wanted to like yell it, but it's kind of like I was frozen. I wasn't scared, but I was kind of just looking like, So I'm seeing the stats drop to 40, y'all. Remember earlier I put the ranges up. That's extremely bad. Like, she's about to die. Stats drop all the way to 40. Literally look at the monitor. 0 pulse at this point. The heart rate is gone. I see asystole. And then at first they're like, oh, call a code. And then the nurse leader, she's like, nope, I feel a pulse. I feel a pulse. It's 30, but I feel a pulse. Sats gone, you know? And at that point, they're like, oh, I suppose, call a code, call a code. Chaos erupts. The other resident physician is like, I lost the code. I lost the pulse too. And that bed went down so quick. And the nurse, she just was jumping on her. The CPR was insane. Like, it's still asystole. I think the patient was down for at least a couple of minutes. No, that's too long. I feel like it was 1 or 2 minutes. But then they were trying to get her pressure up. They finally got it. They did, what was the medicine? Atropine? I don't know. Nurses chime in. I don't know y'all's medications. Multiple doctors kept coming in, but then, you know, people was just like, oh, it's good, like this doctor is here, so they left. But then this other lady, I could tell she was from surgery. She came in and they were just like, oh, this doctor is here. And she was like, it's okay, like it's good to have a friend. So she's helping intubate again. I don't know what that's called, like a second intubation, because she was intubated already. So I don't know what happened with that. But anyway, the first intubation tube was super bloody and filled with mucus. So it's like, maybe that's why, I don't know. But then the second one was good. Then because of all that mucus and stuff, they wanted to do a bronch. So I ended up washing the bronch, and I assisted as well. Like, I put the wash on, but I didn't know how to do it. But you know, when they like showed me, like, I was just like, okay, got it. So quick intervention to that story, because they came in and I am now cleaning all this equipment. Okay, everything is sterilized and clean. What a day, like truly what a day. I'm finally heading out. I gave a report on my 2 floors. I'm leaving. Today has been a crazy day. I don't know how tomorrow's gonna be. I really don't. I feel like that was super dramatic. I'm definitely treating myself to Sprouts. Good morning, everyone. So this morning was really not ideal. It's super late today, so I'm gonna go ahead and start early on my 11 a.m. treatments. I only had to do 1 treatment because the last lady was not there in the room, so now I'm headed back to my little RT room. It is 12:08 right now, and I am currently doing some training for my next rotation. This next rotation is so extra. I feel like the exhaustion of yesterday, like I'm feeling it all today. But yeah, it's way more chill today. It's 2:45. I'm about to head up to do my last round of treatments. I have 6 treatments to do. I will show you guys my screen just so you guys can get an idea of what it looks like. So yeah, those are the treatments. So I'm about to go get one of those carts. Okay, so far I've had 2 denials, and I need to chart the last one. So I still have 2 treatments left, but one of my patients, go down before someone gets on the elevator. But one of my patients is on a non-rebreather because they had a rapid response earlier. I'm like, how do I give a breathing treatment with a non-rebreather on? I'm about to find someone to ask. So it's 6:01 and I just left a meeting here on the 3rd floor. There's this guy that's retiring that's been here for 42 years. So like the whole respiratory staff came out for them, which I thought was pretty cute. That was really sweet. Yeah, they're just down the hall. And I'm a student. They were about to take a picture, so I was like, I'm gonna head out. So yeah, I'm about to leave, and they were cool with it, of course. They are pretty nice people, you know. Anyway, I wanted to do so much more before I left, but it's fine.
I just can't give up. 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 We've been through the fire and we've been through the flames, yeah. I never turned my back on you. I stay the same on you. Them waste boy, they change on you. Them rearrange on you. Ungrateful trait of them. Start more strange on you. When a real man don't play no games, I gotta say it. I really want you.
Morning, everyone. This is the last shift out of 3 this week, and I am just ecstatic to get this week over and to go home tonight. Tomorrow I get to sleep in. I don't have to worry about it getting up at the crack of dawn, and I just can't wait. Excuse my voice. It's the morning, and I am a little like I feel like I'm kind of coming down with something. But yeah, let's get a time check. So it's 6:21. I'm 13 minutes away from the hospital, so we're making good time. It's been a long week. Alrighty, so I'm about to go get report. Okay, I think I'm awake now. I have my Alani and I have my assignment. 1, 2, 3, 4, 5 patients today. So I have 5 patients today. Now I'm gonna see which meds I need and then the times that I need to give them. I'm done like doing the report and figuring out which meds to give and everything like that and the times. And of course this all shows up on the screen, but it's just nice to like have it written down. So like I said, I have 5 patients today. I have 1, 2, 3. I'm seeing all 5 patients now for my morning rounds, and then I only have 1 treatment to do at 11, and then I have 1, 2, 3 treatments to do at my 2:30, 3 o'clock round. So it's gonna be a very light day. I might go to the ICU today, but I don't know, because Wednesday was just a lot in the ICU. Okay, so all of my treatments have went really good. All of my patients are doing fairly well. I'm just waiting on one more patient. When I went in there, she was eating breakfast, so yeah, I'm just gonna come back to give hers. And yeah, that's really it. After I finish her treatment, I'm gonna be done for the morning rounds. But yeah, my patients are doing pretty well, so you know that makes me happy. I only had one patient refuse a treatment, and that was because she said the albuterol was making her jumpy, which it does increase your heart rate, so makes sense. But yeah, probably like just stay up here. It is, what time is it? It's 8:04 now, so we're doing great on time. So yeah, I'm just gonna wait up here, probably like 8:30, and then I'm gonna go back in there to do her breathing treatment. I'm done with all my treatments, and something that I never really like thought about is how breathing treatments taste. TMI, but like she boo-booed on herself, but she's like unconscious, and like that was just like my first time seeing something like that, so that was insane. You know, I'm not a nurse, so I didn't touch anything like that, because I just wasn't, like, we're at the head of the bed. Let me just take these gloves off, because for some reason, like, I'm just like, oh, it's making me cringe a little bit, even though like my gloves, they didn't touch anything like below there, you know. I don't even know what I'm saying, but obviously they didn't touch anywhere below the head. But it's just something about seeing that and then smelling it, it's like, let me take those gloves off. It's nasty. I don't even want to like touch myself right now. Like, I'm gonna take this jacket off because I feel icky. Healthcare is just so unexpected, and it's like you just never know what you're gonna see or get to experience. It's a lot. Hola, it's 3 p.m. on the dot, and I'm about to start my last rounds of the day. Honestly, y'all, I just got back from my car. I took a nice little nap. I don't know what it is, but like I promise you guys, I have never taken a nap while at my clinicals, like until today. Like, I don't know what it is. All my patients got discharged. I only did like one breathing treatment. I love today. All right, so I'm just gonna go ahead and stock my cart already, so I don't have to worry about it later. I'm putting 2 nebulizers with a mouthpiece, and then I'm gonna grab 2 masks, because some people, they're not able to, you know, hold the mouthpiece for their nebulizer, so we always want to take masks just in case. Okay, I just have to document this last patient and I'll be done for the day unless I get a new patient or something like that. So I'm gonna make sure to have my computer up so I can be on top of things, but I'm so happy right now. Patient stated. I love charting. Like, I feel like it's just, I just love it. I'm gonna learn how to type without looking down, but until then, you know. Patient stated he was getting discharged. Now my board is clear. I'm gonna double check my hallways just to make sure nothing crazy popped up. Oh my gosh, so many people got discharged. I think this morning, I feel like the floor is full. Now on one of my hallways, they only have 10 patients. Wow. Okay, today was a good day then. Who is this? Like I said, I am gonna keep my screen up. I'm gonna put it over here just so I can, you know, watch out, but I'm done. today. Okay, so probably my last task for the day is to put this on a patient in the ICU. Patient just came from surgery and she just had like literal tape holding the tube, so we just switched it out with that. It was my first time doing that, so that was pretty cool. So I'm about to clean my little desk up. I need to like hurry up because I need one of the RTs, and the RT that has been here all the days that I've been here, he's about to leave. And so I need him to sign like my little attendance thing to say like, it's not for like the times, it's just for like, she was here every single day. And he's the only one who's been here every single day with me. So who better to ask? Okay, so my little area is prepped and ready to go. Rapid response was just called. Paper signed. I'm just about to go get my sheet for report. It's 5:50. Here's my little report. I'm about to go.